Okay. Good afternoon, everyone. I'm Dr. J Lakhani. I'm an endocrinologist at Zydus Hospital in Ahmedabad. Now, this Facebook Live session, we are going to discuss about hormonal disorders in children. Now, I'm an endocrinologist. I deal with both adult hormonal problems, that is like diabetes, thyroid, osteoporosis, PCOS, and hormonal problems in children. Now, some of the common hormonal problems in children include something like, short height, type 1 diabetes, which is pretty common, thyroid disorders in children, and something which is very rising frequently is pediatric obesity. So these are the things we commonly see in hormonal disorders in children. So before I start taking your questions, I just like to point out a few things which is very important from general, and I'm sure a lot of parents must be viewing this. There'll be certain things which are very common for all children. So first and foremost, I'd like to show you something. This is a growth chart. Okay, so what you see here is in blue color. This is for boys, and you have similar growth charts in girls. Now, Indian Academy of Pediatrics and most pediatric associations worldwide say that growth chart is basically a child's birthright, right? So every child should have his or her growth chart. So every time you go to meet your pediatrician measures the height and weight of your child, and that has to be plotted on this growth chart, right? So you have the sections for height, weight, the BMI on the back, right? Why this is very important? Because a child, when adult becomes sick, he tells you that I'm not well, he doesn't show up for work. But when a child is sick, he may or may not tell you. And especially when you have chronic illnesses in children, they don't know what's going on with them. So this is often reflected in the growth of a child. So if a child is not gaining height, if the child is not gaining weight, if the child is losing weight, child is gaining excess of weight, excess of height, all these things are related with some kind of hormonal or other disorders, which you can pick out by seeing the growth chart, right? So what I insist is one thing which you should take home at the end of this session is that you should ask your pediatrician that every time he or she measures the height and weight to plot it on the growth chart, and to preserve this growth chart till the child becomes 17 or 18 years old. Second thing is that when a child goes to school, we often see that their height and weight are plotted regularly, right? So that also has to be mentioned on the growth chart. Now, something else which I'd like to point out is that, which is very important from a hormonal point of view, is something which is known as screening for neonatal disorders. Now, in the West, you go to Western countries like United States and UK, all children, they are regularly, they check their, some tests are done at birth time, and these are known as neonatal screening tests. Now, there are three important disorders which are checked at the birth time. One is thyroid, neonatal thyroid screening, something which is known as congenital adrenal hyperplasia, and third, which is known as G6PD deficiency. Depending on the country of origin, there might be certain other tests which are commonly run in certain countries. Unfortunately, in India, there's no government program which mandates regular neonatal screening. However, for those parents who can afford it and who are well aware about it, what I would advise is that insist upon doing neonatal thyroid screening in all the children who are born, right? It is generally done on third day of birth. This is very important because thyroid disorders in children are picked up a little late, they are diagnosed a little late, and the brain development of the child depends on the thyroid hormone. So if the child is deficient in thyroid hormone at birth, the child may have delayed mental development. And one of the very important preventable cause of mental retardation is to diagnose thyroid disorders at an early age. So this is something which I'd like to point out. And finally, there are a lot of children who have type 1 diabetes. And I've seen that, parents with type 1, who have children with type 1, they are often, concerned about a lot of things. Now, one important thing I'd like to point out is that the only treatment which is currently approved for type 1 diabetes is insulin. There's no other treatment, there are no oral medications. Anything else which is given is off-label, it is not recommended. Even in insulin, the type of insulin which we have to use is what is known as basal bolus insulin. So you have to use minimum 4 shots of insulin in a day. I've seen a lot of doctors prescribe twice-a-day insulin. This twice-a-day insulin is not recommended for type 1 diabetes. It is only for adults with type 2 diabetes. And even in type 2 diabetes, we are not using it that often nowadays. So mixed starts, no mix, all this type, Humalog mix, All these mixed insulins are not for type 1. They are only for type 2. And for type 1, you need to use something which is known as basal bolus insulin, that is 4 shots of insulin in a day, which is the standard recommended care worldwide. Right? So these are some of the starting points I'd like to just point out. And now we'd like to take some questions if you have. Okay, so one question which has come up is that there's a parent who is concerned, who is saying that my daughter started her periods at 12 years of age, and she's about 13 years old now. Her periods are irregular. Can she have PCOS or PCOD? Now, PCOS is Polycystic Ovarian Syndrome, and it's a common disorder which is seen in a lot of women. It's one of the most common endocrine disorders in women. Now, one of the things which I've seen recently is that there are a lot of obese girls who are, who have just started their periods and who have been wrongly diagnosed to have polycystic ovarian syndrome. What I'd like to point out for parents who are here is that you never diagnose polycystic ovarian syndrome in the first year after menarche. So when a girl starts a period, for initial few years, the periods are going to be irregular. Periods are going to be delayed. This is normal physiology. This is not that the girl is having any disorder. So we often diagnose, a lot of girls are wrongly diagnosed to have polycystic ovarian syndrome. So what I would suggest for these children are that you should, meet your pediatric endocrinologist and have a proper evaluation, because often you get the girls who are labeled wrongly with a disorder which they may not have, right? So the initial few years after the menarche, we do not diagnose PCOS. The PCOS is only diagnosed after some time when the reproductive axis of the girl is mature enough. Only then we say that the girl is having PCOS. So a lot of times the diagnosis is made prematurely, which may be a wrong thing to do. Okay, so this is a question from Rachna Modi. She says that my daughter is obese. Can she have some hormonal problem? Now, a lot of the times, only a lot of parents bring their children to us saying that my child is obese, or my child is fat, right? There are two things I'd like to point out. First of all, as parents, we should not indulge in body shaming of any type, right? So if the child is fat, child is thin, right? Child is tall, child is short. We have been doing this for many, many years. But what I would say is that this is a form of body shaming, right? So please do not tell your child that you are fat. You are Humpty Dumpty. That is what I saw. Tell a parent tell his child. So these are forms of body shaming which they carry for the rest of their life, right? So what I'd like to say is that if the child is obese, bring him to a doctor for evaluation, no doubt. But please do not shame your child. Please do not bully your child, because these children are already bullied in school, right? So that as parents you should not do it. At the same time, 10% of children with obesity may have some hormonal problem. Right? Thyroid, hypothyroidism, underactive thyroid is a common cause of hormonal problem. That is one very important thing. Apart from that, there are a lot of hormonal problems which can cause obesity. There are certain medicines which children take, sometimes for attention deficit syndromes, sometimes for some other epileptic disorders. All these things can lead to obesity and excess weight loss. So excess weight gain. So if your child is excessively fat, if you do believe, please do not shame them. But at the same time, the child may need evaluation, and it's a good idea to bring such children to a doctor for evaluation. So we have one of the comments which Divya has said. One of my friend has hypothyroidism during pregnancy. Should she get a child tested for thyroid disorder? Now, first, like I already said, all children, okay, whether the child's mother is hypothyroid, whether there's a family history of thyroid, all children at third day of life should be tested for thyroid, because hypothyroidism in children is because of absence of thyroid gland, and hence, often it is not diagnosed at the right time. So what I'd advise is that all children, whether the mother is hypothyroid or not hypothyroid, the child should be tested for thyroid at third day of his life. It's a very simple test, right? They just take a heel prick blood. Sometimes they do it from a cord blood, right? So you can directly test for thyroid in children, in all children, whether the mother is thyroid or not. Now, whether the mother passes on the thyroid problem to the child generally does not happen, because when a mother has hypothyroidism, she most likely has Hashimoto's thyroiditis, which is a result of autoimmune disorder of the thyroid. Now, these antibodies are generally not passed on to the children. So a mother who is hypothyroid does not necessarily pass on the disease to the child. There are certain disorders in the mother which can be passed on to children, right? Which are specific disorders, so which your endocrinologist can tell you when the mother is pregnant. However, most of the thyroid problems, most common forms of thyroid problems in mothers are generally not passed on to their children. So I would say not to be worried in that sense. But to answer your question, yes, the child should be tested for thyroid, irrespective of the mother being thyroid, hypothyroid or not at third day of life. Okay, so you have, okay, let's take one of the other question which is there from Roshesh. He says that my son is 16-year-old and he has not started shaving. Is this normal? Now, there is often parents often ask that my child has not started shaving while other children in the class have started doing that. Now, facial hair is dependent on a lot of things. So you'd have seen that let's say people from certain parts of the country do not have a lot of facial hair, whereas people from certain parts of the country may have a lot of facial hair. So the facial hair depends on a lot of factors. It depends on the genetic origin of a person. It depends on certain hormonal issues. It also depends on the skin condition, right? So there are a lot of things where facial hair depends on. However, if the pubertal development of the boy has not started up till age of 14 years, that's abnormal, right? So generally, by the age of 14 years, all children, all boys have the pubertal development. The testicular volume increases, penile length increases. These things start at 14 by 14 years of age. But if this has not started, then the child would need evaluation and child would need treatment as early as possible, right? So what I'd say is that if the boy has not started shaving, if you're concerned about it, look at his pubertal development. If you are concerned about that, meet your doctor and they may tell you what to do next. Okay, we have a question from Mamta who says that my neighbor's child is 7 years old and she's the shortest in the class. Does he need evaluation? A lot of the times we all aspire that our children become tall, right? We all want to be tall ourselves. It is said that most of the world leaders have been tall. There is no American president who is short. All American presidents have been tall, and all have been male, which is very strange in that sense. However, so height is important from a society's point of view, but everybody wants their children to stand first in the class, right? So if everybody is first, then who is second, then who is third, right? So all children cannot. There has to be someone who is shortest in the class. Often the height of a child depends on the height of the parents as well. However, if the child is extremely short and you're concerned about it, again, the child may have certain serious hormonal disorders which needs to be evaluated. So like I said, you meet the best thing is to meet a pediatric endocrinologist, have the child's growth chart plotted on this, something like this. We also mentioned the height of the parents in this, right? And we compare the height of the child vis-a-vis the growth potential of the child, and then we decide whether we need any kind of evaluation of the child or not. In many cases, we don't need any evaluation. We just need to see the height of the child. We need to plot it on the growth chart and say that this child is fine. A lot of cases we do need evaluation. So it depends on the condition to condition. But if you're really concerned about it, you must bring the child over, and the child must be. We can have a look at the child. Right? Okay. So we have Rupal Modi. So that's what Rupal said. Sejal has asked that what is the normal age for having periods? Now, as the society is becoming more and more fat, the age for menarche, when girls start having their first periods, is reducing day by day. At present, the average age for a girl to start her periods is about 12.5 years of age, which is generally they are in 8th or 9th class. If it occurs, if the periods start early, right? Let's say before 9 years of age or before 8 years of age, that is definitely early. And if a girl does not have a periods up till 15 years of age, that is also abnormal. Again, in both the conditions, you should have evaluation of the girl, right? So that is very important thing we should keep in mind. Let's take one more question, which is written down. So this is a very important question. Alka has asked that my daughter is 6 years old. She has breast development already. Is this normal? Now, normally girls start having their breast development at about 10.5 years of age. That's the normal average age. If a girl starts having a breast development before 8 years of age, that is known as precocious puberty or early pubertal development. And in such cases, we definitely need to bring the child over to a pediatric endocrinologist to have the child evaluated. Because having the breast development before age of 8 years is definitely early, and the child should be tested, right? So if what they've asked is that the daughter is 6 years old and she has already had breast development, so in that scenario, the girl definitely needs evaluation, right? So you bring it over to an endocrinologist and he can have a look at it. Okay. So Payal has asked in Hindi, मेरी बेटी 14 years की है और उसका वजन काफी ज्यादा है और पीरियड का प्रॉब्लम है, अब दवाई लेकर रेगुलर हो गया है, पर इसमें क्या करना चाहिए, राइट? सो very important question. So this I already answered in one of the previous questions. Now, Payal's daughter is 14 years, right? So I'm most likely her period started at about 12 years of age. Now, for first 1 or 2 years after starting of the periods are irregular, right? They are irregular. That's normal physiology. A lot of these girls have, their reproductive axis is being matured, so they may have irregular periods. Doesn't mean that the girl has PCOS. Doesn't mean that the girl has any kind of problem. So what I'd say is that generally for the first year, wait and watch. But after the second year, if that goes on, you would need an evaluation by a doctor. So what generally I would advise is that in such a scenario, you should bring the child over to a pediatric endocrinologist like me, and they should have the child being evaluated. We can do certain tests to see if there's any hormonal problem. If there's no hormonal problem like PCOS, then the child can we can advise certain things which can help normalize the periods. So a lot of girls who are obese, who are overweight, they tend to have more irregular periods, and in such cases you need evaluation. Okay, Ruchi has asked that one of my friend's child was diagnosed with underactive thyroid. Can she try homeopathic treatment for the same? Now, a lot of people who know me know that whenever parents ask that, my child is having hypothyroidism, underactive thyroid, should I start homeopathic treatment? It really angers me. That makes me very angry. See, I do not have any problems with homeopathic or Ayurvedic treatment, right? They are complementary alternative medicines. They are all fine, right? But for children, my strong advice to all parents is that for children, please do not, consider these treatments which are not recommended. Underactive thyroid in children is a very common problem. Simple problem has a simple solution. So the child's body is not producing adequate thyroid hormone. So what we do is we give thyroid hormone from outside. So it's a simple problem and there's a simple solution to it. It's a simple single tablet which the child has to take. There is no homeopathic. So if a homeopathic doctor says that there is homeopathic treatment available, I'll seriously question whether the person really knows what hypothyroidism is, right? Because a simple problem has a simple solution, right? And for children, right? For adults, you can do whatever. You are an adult. You can try whatever things you want. But children, I please beg of you, please do not use any kind of homeopathic Ayurvedic treatment for thyroid problems in children, because the thyroid problem in children is simple to treat, and if not treated, can have very severe adverse consequences in later life. The child will remain short, the mental development may not be adequate, the sexual development may not be adequate, and once the age passes, you may not be able to do anything after that, right? So it's a very simple disorder, and it needs a very simple treatment, and this, it's not recommended to try any kind of complementary alternative medicine in such children, right? It's a simple disorder with a simple treatment, and that's what I suggest you should do. Okay. Divya has asked, irregularity in periods at the age of 21, is it normal or is it alarming? So a lot of girls have irregular periods for a lot of things. Now, so periods are dependent on a lot of things. First, it depends on the hormones. It also depends on stress. It also depends on food items. It also depends on what kind of whether you gained weight, whether you lost weight. Like to give you an example. For example, you'd have seen professional athletes, right? Those who compete in Olympics. These women, they train very hard, right? They are constantly in training, and often for a long period of time, when they're training, when they're undergoing their athletic training or when they're training for a competition, they don't have periods, right? So because they are under extreme stress, their diets are different. They're losing, trying to lose weight. They're trying to maintain a particular weight. They're training hard, so they do not have periods. Now that doesn't mean that those women are abnormal. In fact, those women are probably the most athletic women, right? So if your periods are if you miss out your periods, if they're irregular over time, it's not alarming. At the same time, if this consistently remains and there's no other reason for it, you should have it checked out, right? So that is what I would suggest. So in such cases, you need to have an evaluation where it remains persistent over time. A lot of women who change jobs, they move to another city, they have brief period of time when the periods are irregular, and that's fine. That's normal physiology. But if it remains persistently irregular for a long period of time, it must be checked out and must should have a look at it. So that is what I'm suggesting. Okay. So we have Priya. Yeah, so this is a similar question, right? So again, Priya was diagnosed to have thyroid disorder during her pregnancy, and should her child be tested for thyroid hormone? Like I said, all children, whether their mother has thyroid problem or not, at day 3 of their life should be tested for thyroid and certain other disorders which are common part of neonatal screening. In fact, a lot of state governments have taken up pilot projects for making this as a sort of a routine in all children. It's still under pilot project stage. It requires a lot of funding from the government. So eventually, after let's say 10 years from now, just like you have a common vaccination program in all children, the government may come out with a program which mandates regular screening for neonatal disorder in all children. However, as of today, it is not done by the government. The government does not pay for it. It is not done in all children. So as active and if your parents who are well educated and well aware about these things, I would suggest that all children at early onset of their life should be tested for thyroid and certain other disorders as a part of neonatal screening, because these are very important disease, and only 1 in 3,000 may have a problem. So it's not that all children will have it, but if the child is 1 in 3,000, then early treatment will lead to dramatically good results at a later date. So that is a very important thing. Okay, so I think I'll just end up here. We don't have any more questions, so we can end. In the end, I'd like to say a few important things which sort of came out from the discussion which we had today. One, consider neonatal screening in all children at birth. Secondly, there's no homeopathic or Ayurvedic treatment for underactive thyroid in children. It's best to treat it with levothyroxine, which is basically the natural form of thyroid hormone, which is now available as a medication, and it's easily available, easy to treat. And finally, missing out a few periods is not alarming. I mean, having irregular periods for a while is not alarming, but at the same time, if it remains persistent in girls, you should have it tested. And if the child is short children may have hormonal disorder. So, have your pediatrician or have your doctor, make a growth chart, and then you can follow that up. I think you have one more question. Just one more question. Vivek has asked, sometimes parents complain about the children gaining excess height. That is still 10th and 11th standard, the height gain was really good. But after that, his friends had good height gain, but the child didn't gain much, and though had a normal height in the end. So these are children. There are certain children we call it as early bloomers, right? So they have early period, they have their height increases. They are the tallest in the class, and eventually they become one of the shortest in the class. The reason is these boys may have early pubertal development, early development of the puberty, and because of that, initially when other children are still not having the puberty, these boys have the pubertal development, and because the pubertal development occurs early, their bones also fuse early, eventually leading to short height, right? Whereas the other children who have been growing normally, they have normal height. So such children who at early age are gaining excess of height, again, that can be a sign of early puberty, and that children should be tested. Right? I think we should end here. Thank you very much. Right?